With an uptick in vaccine supply, more than half of the country's provinces have announced some kind of move to reduce dose intervals.
Our delivery plan for second doses has been sped up by about 2 to 4 weeks.
Everybody being vaccinated prior to August 31st.
We are planning for all eligible Manitobans to receive their second dose should they want one by end of July.
During a vaccine drought, the National Advisory Committee on Immunization stretched out the gap to 16 weeks to protect as many people as possible with a first dose.
The initial strategy, I think, was ideal for the situation we were in. It's time to change.
Dr. Fahad Razak has seen a dramatic decrease in patients in the Toronto COVID ward he's been running.
The patients who I admitted with COVID, they fall really into two groups. The first is people who haven't received that first dose, but the second are people who have received it, but probably didn't mount enough of an immune response and would have benefited from a second dose.
He and many others are pushing to get second doses into more at-risk Canadians faster. And while there is recent data out of the UK suggesting the antibody response is greater in older people who waited 12 weeks between Pfizer doses,
but we actually don't know if that makes any difference, practically speaking, in terms of the immune protection that you have.
There's also the separate issue of AstraZeneca, with questions around whether Canadians will be able to choose an mRNA vaccine for their booster. Thursday, Quebec announced people can get a second AstraZeneca shot after just 8 weeks.
I'm very worried that we're basically going to end up throwing vaccine away.
While in Ontario, confusion prevails. It took family doctor Michelle Cohen 2 weeks of phone calls and upset tweets before Public Health picked up her leftover 230 doses, expiring May 31st.
We don't know what's going on. We keep asking. We're offering to drive at places. We've got no information. So I was pretty angry.
Global News asked federal public health officials if they expect provinces to eventually get down to the manufacturer recommended interval. That's 3 or 4 weeks for Pfizer and Moderna. Dr. Howard New said he didn't think provinces would drop below an 8 or 10 week gap, but he pinned his answer to science rather than supply, saying that could change based on new data. Abigail Bimman, Global News, Ottawa.